And it's me, nurse practitioner Dr. Katina Kennedy, here with more health information for you. Today, let's talk about anemia. Well, anemia is such a broad topic, but we're specifically going to talk about the most common, which is iron deficiency anemia. This is when you have a decrease in iron in the body and it causes low blood cells in the body. So that's iron deficient anemia. What are some symptoms? You may have short of breath. You'll feel generalized pain, achiness, cravings. Some people have weird cravings such as ice, dirt, clay. Yes. Lightheadedness, dizziness, just being irritable, and also headaches. And then also you may be pale as well. So those are some serious symptoms of anemia. A lot of people think that anemia is, really nothing, but it can cause a lot of those symptoms. A lot of times when you're constantly weak, you're tired, unable to concentrate, it's because you have lack of oxygen, lack of those blood cells that's giving that oxygen to the tissues. So that's iron deficient anemia. Those are some symptoms. Now, what causes it? There can be a number of causes. It can be because of heavy bleeding during our menstrual cycle. You may have extreme heavy bleeding, or miscarriage can cause that. Any type of heavy bleeding. Also, if you decrease your foods in iron, a lot of my vegetarians who don't supplement the foods with iron, they have low iron as well. So it may be because you're not eating enough foods with iron in it. And then also our older patients who have anemia, who don't have like a period, because why are you anemic when, you don't have your periods anymore? This can be because of internal bleeding. So if the blood is low, if you have iron deficient anemia and you're older, this can be because there's something going on in the intestinal system. And then also those who've had surgeries, like intestinal surgeries, like gastric bypass, the iron absorption is decreased. So again, heavy bleeding, your decreased foods with iron, internal bleeding, or those who've had some type of intestinal surgeries can have iron deficient anemia. Also, if you've had like celiac disease, so when you come to your primary care provider, there's a workup that we have to do to distinguish if you do have iron deficient anemia, because again, there are so many different types of anemia. What are some of the treatments? Well, we have to find out the cause. But in the meantime, to help bring that iron up, iron pills. Some people can't tolerate iron pills, so then we have to send them to the hematologist for IV iron. That means they get iron through intravenously, or they may get a shot of iron. Also, increase your foods with iron. Sometimes it can be as simple as that. For those who eat meat, you have your red meats. It's very, very high in iron. Also, if you are vegetarian or you don't really eat red meats, you have your nuts, your dark green leafy vegetables like your kale, your collard greens, string beans. Those, are high in iron. So also just Google foods high in iron so that you can find out what has high iron, so that you can start eating that to bring up that iron level in your body so that you can feel a lot better. Also nuts, certain beans, kidney beans are high in iron as well. And then also get you some vitamin C on board. Google foods that's high in vitamin C. You got your orange juice, your oranges, your watermelon, so much more. I can't go through the list, but just Google foods high in vitamin C. But the vitamin C helps iron absorb. All right, so we just talked about some of the symptoms of iron. If you're having some of those symptoms that I just read off, go see your primary care provider so that they can go ahead and examine you, do some blood tests on you, and treat you. Having low iron deficient anemia is not fun. You don't feel good at all. And so many women and men go through life having feeling weak, feeling tired, because they think that this is a normal feeling. But you don't have to feel that way. There is hope. Go see your primary care provider. Check your blood count. If you are low in iron, you have those options I just mentioned for you as well. Don't forget to follow me on YouTube for more of my health videos. Nurse K. Kennedy. Talk to you soon.